Two controversies, treating the mentally ill whether they agree or not, and the need to raise transit fares. The Point starts right now. Mayor Adams unveils a controversial plan to treat mentally ill homeless people whether they agree or not. And Williams-Isom, the city's deputy mayor for Health and Human Services, is here to talk about it. First question, Madam Deputy Mayor, is that Mayor Adams is trying to do something that no other mayor has ever tried to do before, get the mentally ill homeless the psychiatric treatment that they actually need, whether they agree or not. Why do you think this is the right strategy for the city at this time?
So nice to be here with you, Marcia. I wouldn't say that no one has ever thought about this before, because there actually is a state law that allows people to do involuntary.
But nobody ever really did it.
But that's the point. I think it's been so interesting to me to see the mayor say there is a law. The Office of State Mental Health has given us some guidance, and so now I'm going to make sure that I have a whole of government approach to this issue, this very serious issue of the unhoused, who are people who are unsheltered and have severe mental illness. I mean, you probably know there's 250,000 people in New York City who have might be both bipolar, major depression, schizophrenia. We're talking about the subset that are unhoused and that have serious mental illness. It's a very, very small subset. And I think we're an administration that looks at things on the ground and sees what's going on. And so for the past 11 months, not just the mayor, but myself and many other people in the administration have gone out. And while it is always our goal and our preference to have somebody be brought in voluntarily, sometimes your mental illness makes it so that you don't even know that you're sick. And so we felt like we really wanted to focus on the part of the law that talked about basic needs and whether or not somebody not being able to meet their basic needs will put them in danger. And we just felt like New Yorkers, we couldn't just leave people out there with no help. So I think the mayor feels strongly, whether or not he gets criticized or he thinks that it's going to, you know, everybody's not going to love it. There's 8 million people, and he says there's 8 million opinions, that we had to take action.
But he also said when he announced it that the people in the administration who worked on it, including you, obviously, as the point person, felt really passionately that this is the right thing to do. Tell me why it's such you felt so strongly about it.
Well, it's funny. I don't know if he said we felt passionately. He said that many of us had passionate opinions, because I think we are a reflection of New York, where people were concerned about individual rights. When people were concerned about, how's the training going to go? When people were concerned about, we've got to make sure that we get this right, because it's a very important thing to do when you bring somebody in involuntarily. So we had very heated discussions, and we came together and we said we want to do this. We want to do it right. I'm a lawyer by training. Of course, I'm never going to say that I want to violate anybody's rights. That's not what we're talking about. But I think what people have missed, Marcia, is the outreach workers, the clinicians that are doing this work, they're not making the determination of whether somebody stays in the hospital. All we're saying is that you can't walk by people, and we have to bring people to the hospital to get the assessment.
Where a person who has training can actually make the assessment
100%.
As opposed to somebody on the street.
Exactly. And I think Dr. Mitch Katz, who you saw and spoke, and we have Dr. Vassan, and we have Brian Stetton, all these experts, talked about the fact it's really hard to make an assessment on a subway. It's really hard to make an assessment.
It's noisy, you can't really hear.
So that's not what we're talking about. It's a set of questions that you ask to see how people are doing, but you are able to see if somebody looks like they are starving or not able to eat, somebody is in a really bad situation, and then we take those people, most of the time voluntarily, to the hospital, where then they can make an assessment.
You know, the mayor's plan really depends on having enough beds. He said he's going to have a bed for everybody, but right now there's only 50 beds that were paid for by the governor.
Correct.
What are you going to do if you need more beds? I mean, to some people, 50 seems like a drop in the bucket given the size of the problem.
So, two things. First, I want to say thank you so much to Governor Hochul and all of the folks in the state who've been walking with us through this journey. And really, when I say about them being on the front lines too, Commissioner Sullivan is just fantastic and has really helped us with this work. I think that 50 beds are where we start, right? We can't just say, oh, we want to wait, because we don't have enough. We think that there's people on the streets right now, New Yorkers, that we don't want to leave on the streets because we say we don't have enough beds. So we're going to start, and we're going to work very closely. We have a meeting with a group of hospitals in December 12th to talk about what happens when you get to the hospital, and then we're going to continue to work with the state to open more psychiatric beds.
So what happens when you get to person 51 and you only have 50 beds?
So I'm sure that by the time we get to 51, I know that there's going to be another set of 50 that the state is going to be giving us. I think those are going to open up in January.
Will they be in public hospitals, or will they be in private hospitals?
I think.
And who pays for them?
I think there's going to be some that are in Creedmoor. There's going to be some that's on Randall's Island, and those, from my understanding, it's going to be paid for by the state.
So you could open up spaces in Creedmoor, the former psychiatric hospital?
That's what I think.
And in Rikers, there's a place at Rikers too?
Did I say Rikers or did I say Randall's?
You said Rikers.
I did not mean to say Rikers.
You said, so you mean Randall's Island?
Randall's Island, yes, yes.
So there are spaces there you think that you could, you could open up?
Yeah.
Do you have any sense of how many beds that might be?
I think in total we're going to start with 100.
That's really amazing. And the state's going to pay for everything?
As far as I know, Marcia, and we're going to continue to work in partnership, right? This has been a problem that has been going on for 40 years. And so when people, I think, you have been so critical of the mayor saying we need to get folks that have severe mental illness connected to psychiatric beds, I think about this as we want to improve people's quality of life. We want to improve people's health, and we want to get them connected to community-based organizations when they can and improve their social connections. And so there's a larger plan that we will be talking about soon that will continue to grow as we do this work.
So there's a new audit from the controller DiNapoli that found that 1 out of every 4 homeless shelter clients with serious mental health issues were not placed in mental health shelters. Is there something that you can do about that? Do you think that his numbers are right?
I have to definitely look at the audit. I know that we've gotten that and taking a deeper look at it, but I think that this idea about even in shelters making sure that we have enough beds is something that we have to really look at. I think there's wait lists for people for programs, and so this whole mental health system we need to take has been really neglected for a long time, Marcia. So here we are. Yeah, we're 11 months in, but we really have a comprehensive plan, and the mayor really wants to think about what's the mental health agenda. We know that there's workforce issues. We know that there's equity issues in terms of what's available for people in communities of color. We know that we need to use telehealth more, right? Because the workforce issues are national issues, so we know that that's not going to get settled right away. So I think all of those things are what we're putting together to be smart about this so that we could, you know, move the needle some.
So as you know, the plan is getting some pushback from both civil rights groups and homeless advocates. What do you want to say to them?
I think everybody has a role to play. And I think I've considered myself a child and family advocate my whole life. And so I think people should hold government accountable. And I think people should make sure that we do the right thing. But when I hear people say that we should rescind the plan, that doesn't make any sense to me, because I feel like as a New Yorker, what New Yorkers want us to do is to help our brothers and sisters that are in the subways or in the streets and have severe mental illness. I can't imagine that anybody is saying to us, no, don't do anything.
Well, I think that what they were saying is that some of the advocates feel that it's traumatic for people who have severe mental illness to find themselves taken to a hospital. What's your counter-argument to that?
So I don't even want to have a counter-argument, because it is traumatic. It's traumatic to live on the streets. It's traumatic to not know where you're going to eat. It's traumatic to be disconnected from your family. My whole career, Marcia, what I've done is, what would I want if it was a family member of mine? And when I speak to the family members of people who have folks that are on the street, they say, I wish somebody would come and get them. And I've been trying for years and years to get them in. I would appreciate maybe if they came in, because very often when you come in off the streets, you get settled down a little bit, right? And you're able to get on your medication and then maybe able to be fine. But I approach this with a sense of urgency. We can't really wait, and with a sense of love and compassion, and that's what I would say to them.
So I want to know, what happens when the treatment's done and they have to go to leave? Is there enough supportive housing? So we have about 1 minute left. But,
okay, but I think
is there enough supportive housing for them?
I think we need more.
What do you do?
We need more supportive housing. We need more programs like clubhouses where people can go and they can get connected to work, and when they can get connected and have a community of people that are supportive. So there is much more work that needs to get done. But as the mayor said, we've got to start, and so that when people then are discharged, they don't fall through the cracks, but we're giving them a warm uniform handoff to a community-based organization.
And you're committed to doing this.
I'm committed to doing this. This is what our job is. And I tell people,
tough job.
It's okay. I say every day, I am glad to be in this seat, and I'm glad at this time in this post-COVID world where we have all of these challenges, people who are New Yorkers and love this city and love the people are the people who I think should be in leadership, and that's who I think the Adams administration is.
Well, thank you. We're going to have to leave it right there. Up next, the man driving the trains for a potential fare hike. MTA head Jana Lever is my next guest.